to start with a personal anecdote. It was 4 o'clock in the morning at the George Washington University Hospital, where I was a senior medical student, and I was called to the room of a patient to change her IV. I had been there before. She knew who I was. She had presented at the emergency room about 3 weeks earlier with a gangrenous foot. She had a long-standing diabetes that was terribly neglected, and after her evaluation, the recommendation was to have an amputation. Very common. But she refused the amputation. So the medical team was forced to think, what can we do? And what we did is put her in a bed and put up an IV and said, for the next 6 weeks, you're going to stay here on IV antibiotics. We knew we weren't going to win this battle. She was going to have the amputation anyway, but we thought this is all we could do. I thought it was pretty good with the needle, but every time I would go in to change her IV, she would curse me a blue streak and say, you're just making my life here more miserable. And I would mutter under my breath, thinking, why don't you just get the amputation over with? This is not going to work. We were wrong. After several weeks, she left the hospital with her foot still attached.
Let me show you what diabetes looks like when you are an infectious disease specialist. This is an infected diabetic foot ulcer, a common consult that I would get at the VA. Some of these patients just end up like this. They don't get better.
Does meat cause diabetes? After doing multiple different controls, meat does correlate with diabetes. Now, do we have a mechanism of action? And we do. We know that saturated fat and inflammation lead to fat going into the muscle cells. You got to understand, diabetes is not a problem of carbs, it's a problem of carbs utilization. We know there's a problem with carbs utilization because your blood sugars go high, but too many people focus on the fact that the blood sugar's high. It's high because of the actual problem.
Something is gumming up the lock in our muscle cell. What's gumming up the lock in our muscle cells? It's intramyocellular lipids, or fat, in our muscle cells. So in response to a high-fat diet, those fatty acids in the bloodstream, they enter the muscle cell, they break down into free fatty acids and all of these toxic breakdown products that together block the insulin signaling pathway. This approach to treating diabetes, as recommended by the American College of Lifestyle Medicine, is a more plant-based eating style.
Every cell in our body is made to use sugar for energy. We have receptors in the cells that bring the sugar into the body. Now, the key to unlocking the receptors that allow sugar to go into the cell, the key is insulin. But if we get fat into our cells, it blocks where the key goes in. And the cell can no longer get the sugar into the cell for processing, and then our blood sugars rise. And then you start getting complications with high blood sugars.
And the starry sky in the background, as many of you know, is the intramyocellular fat that's responsible for disrupting insulin signaling. You know, just an example, this is a large meta-analysis that showed that 44% of patients with type 2 diabetes could stop their insulin in just 4 weeks on a strictly whole food plant-based diet. And 74% of patients with type 2 diabetes on oral medications were able to leave this center drug-free within 4 weeks. The medications that we use have a lot of significant side effects and don't substantially change it for the majority of patients.
Could we prevent diabetes, the diagnosis of diabetes? So how did metformin do compared to placebo? 31% reduction. So 31% of the time, it prevented the development of diabetes. That's pretty good, right? If we were able to prevent that catastrophic course that I just described, 31% of the time, that's pretty good. But metformin is a drug. It has a side effect profile. It has a cost. What about lifestyle intervention compared to placebo? How did it do? 58% reduction in the development of diabetes. Nearly twice as effective as metformin, yet today in clinical practice in the United States, more often than not, we just write for metformin. And yet we have a randomized clinical trial published in the New England Journal of Medicine, the gold standard, that clearly tells us that lifestyle is twice as effective.
And I found in these very good studies where they use that type of analysis, there kept being this correlation between meat and diabetes, and meat and prostate cancer and other cancers, and meat and obesity.
And if you change what you eat, the insulin resistance can turn around, and it can get better. And diabetes, in some cases, even goes away, or if it doesn't go away, it becomes much more manageable. And our own research team found that when people have long-standing diabetes with complications of neuropathy and their feet are hurting and they're having ulcers and so forth, even that person can improve dramatically if they make enough diet and lifestyle changes. But we were ready to amputate her foot. And not one person on the care team during the entire time she was in the hospital talked to her about food. Now, I think we could be forgiven a bit, because at the time, we didn't know what food could do.
Diabetes is exploding in our country, right? When I was in medical school 25 years ago, rates of diabetes in this country, 2%. Today, we're brushing past 10%. And the CDC ominously predicts that by 2050, by the time my son is my age, 30% of Americans will be diabetic. 30%.
As you know, half of Americans today are diabetic or pre-diabetic. Half. That's crazy. Now, it turns out that we spent over $300 billion last year on the US just on treating diabetes alone. So this is a huge problem. Now, it turns out that lifestyle changes are actually better than drugs at preventing type 2 diabetes. This is from the landmark diabetes prevention program, where they found that lifestyle changes actually were better than drug and better than placebo at preventing diabetes. And lifestyle changes are also better than drugs at treating type 2 diabetes. Now, a lot of doctors thought, well, if we could just get tighter control of the diabetes, give them enough medication, they can get their blood sugar way down, that'll help prevent the complications of diabetes. But it turned out that a review of a number of studies found that when you get your blood sugar down that low, it creates its own problems. People fall asleep when they're driving, or they pass out in their house, or they drown, or whatever. So you really, you have a double-edged sword there.
You just here to get drugs, or to, get a little better, or lose weight, or you really want to totally get rid of your diabetes and become non-diabetic, get off your blood pressure medications, get completely rid of your psoriasis, and get totally well. What do you want from me? Do you want me to take out all the stops so you can get totally better and get free of illnesses or do you just want me to give you drugs?
It's not sustainable. Our healthcare system will implode. Something we're doing in clinical medicine isn't working. Developing yet another drug to treat diabetes is not the solution to the problem.
There's a very strong correlation between protein and diabetes, but it's animal protein. If you look at plant protein and diabetes, you don't see that.
And all of these things have been connected to and associated with excess intake of protein, particularly animal protein.
But if you get your blood sugar down with diet and lifestyle, you can prevent virtually all of those complications, not necessarily if you get it down with drugs.
We know that high protein diets are associated with impaired glucose tolerance and insulin resistance that leads to diabetes. A lot of the problems that we have with the diseases we're seeing, including autoimmune diseases, is because we're consuming animal tissue, and that's absolutely true. So animal protein has been linked to a number of diseases, including heart disease, cancers, diabetes, osteoporosis, prion diseases, Alzheimer's and other dementias, high blood pressure, stroke, kidney failure, kidney stones, dysentery, foodborne illnesses. Both meat and dairy are potent cancer promoters, and then studies suggest putrefaction of animal protein residues in our colon releases toxins that exacerbate problems like depression, mood behavior disorders, ADHD. The amino acid composition of animal protein also increases something called homocysteine.
You would figure that the meat eaters have higher protein intake, so therefore they would live longer, but no, you'd be wrong. The vegans live the longest, have the least diabetes, which struck me, because I thought, well, the vegans are eating the most carbs, the least protein, surely they would have the most diabetes, but by far the least, by far. And I started to see this pattern all around the world.
Also, we know in the diabetes world, and this is from Dr. Hannah Kaliova down at Barnard Medical Center, the whole food plant-based diet is a very effective way to not only reduce medications, improve weight, and improve insulin sensitivity, but in this study, where they compared it against the diet of the American Diabetic Association, we can see at the bottom that some really significant physiologic factors changed in the whole food plant-based diet that did not change in the ADA diet. And that was adiponectin and leptin, vitamin C, superoxide dismutase, glutathione, versus no change in the ADA group. So all of those factors indicate that it's not just enhancing insulin sensitivity and improving the outcomes for people living with diabetes, but it's also radically transforming their entire system which sets them up for greater health in every area of their lives.
You know, Neal Barnard and PCRM doing some wonderful diabetes reversal studies. I mean, those are the things that really, I think, capture people's imagination. So yes, we know people eating plant-based have between 2 to 3 times lower likelihood of becoming demented later in life, can actually reverse.
Diabetics, they develop strokes. They develop pneumonias when they're intubated. It happens. But this is deeply disheartening to me because I know that diabetes is largely preventable.
You know, these same diet and lifestyle changes can not only help prevent but even reverse the progression of so many chronic diseases if they're really, to me, the same disease masquerading and manifesting in different forms, because they all share the same underlying biological mechanisms. It's one reason why you often find, you know, in the same person, they may have what they call comorbidities. They might have high blood pressure and high cholesterol and diabetes and be overweight and have heart disease.
All right, so again, all plant proteins have been shown to have a beneficial effect on our cholesterol level, bone health, exercise physiology, immune function, kidney function, colon health, bowel function, reduce the risk for diabetes, improve vascular health, acid-base balance, decrease cancer risk, heart disease risk, risk for dementia and Alzheimer's, depression and mood and behavior disorders. And hopefully we'll end up looking like those people too.
Eating a healthy diet defined as one rich in fruits, vegetables, whole grains with limited animal sources. Not smoking, obviously smoking the worst thing you could do. Exercise 3.5 hours a week, it didn't take much. Just walk 30 minutes every day. And maintaining a healthy weight. This is not asking a lot. What type of benefit did those that adhere to these 4 healthy lifestyle behaviors achieve? Those 4 healthy lifestyle behaviors, 80% reduction in chronic disease. But specifically, if you look at the details behind that number, 93% of diabetes was prevented. This is the disease I just told you is exploding in our country. We have the information, the understanding today in 2019 to prevent 93% of diabetes, and yet diabetes continues to grow in our country.
And as time went on, I realized we were wrong in another way. And that was she had long-standing diabetes. And as you heard this morning, diabetes, type 2 diabetes, has its foundations in insulin resistance. And insulin resistance is triggered by foods.
And what's so amazing to me, and I think many of you that are practicing this way experience this as well, that for so many people that have injured their bodies for decades, their solution is just 2 weeks away. That even though you can make bad choices and injure your endothelium and disrupt your angiogenesis and your microbiome, you can begin seeing benefits in early as 1 week. That your body's natural state is toward health, and that when we do the right thing, our body can naturally begin self-renewal process when we give it the right foundation and the right environment to begin self-renewal.
Think about the natural history of type 2 diabetes. You know, when that 62-year-old patient shows up in my office with that infected diabetic foot ulcer, that didn't happen overnight. There's a lot of history that predates that presentation in my infectious disease clinic. Right? Maybe that gentleman's story starts in his late 20s when he starts a new job. And he's commuting into the city an hour and a half. It's a very stressful drive. And then he gets to his office and he sits behind a computer for 8 to 10 hours. And he feeds on some pizza or cheeseburger while at the desk. Somebody brings it over to him. He's so busy, he's so stressed. Then he gets back in his car, he drives another hour and a half, and then exhausted, he pulls into a drive-through, picks up some food and maybe a 6-pack, and then comes home, sits in front of the television, eats, drinks a couple of beers, passes out on the couch, next day, repeat. And his lifestyle, that poor sedentary lifestyle leads to excess weight, obesity, right? And obesity leads to insulin resistance. And insulin resistance, unchecked, patients fall into the pre-diabetic state. Hemoglobin A1C between 5.7 and 6.4. That's what I call the warning period. At this point, diabetes, the diagnosis of diabetes has not yet been made, but the patient is in that window. And in large part, patients are asymptomatic. They feel fine. They might complain. They really don't have any complaints. It's not until you actually develop diabetes, and that's when they start to complain of polyuria, polydipsia, and now they come to the healthcare setting. And we see blood sugars of 300, hemoglobin A1C of 7.58, and we make the diagnosis of diabetes. And now all hands on deck, the endocrinologist, the internist, the family practice physician, and what do? We write a prescription for medicine. And we usually start with metformin, that's our first line agent. And that's not enough, we add a second target, maybe a third. And when oral regimens are no longer effective, we switch over to insulin, right? But all of this up and down and up and down and up and down, we start to see damage to end organs. We start to see sequelae. So patients start to complain about some of these complications, like they might report to you, you know, doc, I'm feeling this like numbness and tingling in my hands and feet. That's glove and stocking distribution, diabetic neuropathy. Or, you know, doc, when I climb up a flight of stairs, I'm starting to feel a little winded, or I feel a little heaviness in my chest. Atherosclerosis, right? Or we might dip some urine and notice a little bit of protein spilling. Early kidney damage. And then a few more years go by, and then we have that disabling catastrophic event, the heart attack, the stroke, blindness, amputation, renal failure, and then death. And that's the very sad story of type 2 diabetes. And I started to think about where I met this gentleman in his timeline, in his lifespan. Where was I? I was primarily here. Along with my friend, the neurologist, and my friend, the cardiologist, we were sort of concentrated there, and we were trying to put out this raging fire with what felt like a glass of water. I felt very, very ineffective. And I started to think, what if I could somehow travel in a time machine and meet this very same gentleman here during that warning period, during that pre-diabetic period? Could I introduce some intervention that could prevent all of this complications, all of this pain and suffering from happening? Or better yet, could I travel further back and meet him here and prevent the obesity from happening?
I had a patient that had come to see me, and it just, I tell this story because it also gives such encouragement that when people want to do it, they can find a way. And she had come to see me, she had significant pain, was overweight, on multiple medications, had just come out of a very abusive relationship, and she and her son were living on very little money. And she understood that a plant-based diet could radically change her life. So she and her son decided they were going to do it. They didn't know how they were going to do it on food stamps, but they learned that a grocery store threw out their organic produce at 2 o'clock in the morning every night. And so they would get in their car, and they would go over and they would gather this organic produce, and they began to eat this food, and I didn't know she was doing this. And then I saw her 3 months later, and all of her pain had been reduced down to almost minimal pain. She got off all of her pain medications. Blood pressure was normalized. She was able to discontinue her medications for diabetes, and she lost 60 pounds because they found a way to make it happen.
And to get better, and to get well, you have to have a mindset of a champion. You have to encourage people that this is going to be difficult at the beginning. They have to be determination and perseverance, and they have to repeat over and over again and practice this and just do it right.
That means we're focusing on fruits, vegetables, whole grains, beans, and as you can imagine, these foods tend to be very, very low in fat. By following a more plant-based diet, we can unclog the muscle cell and repair the underlying mechanism, actually addressing the underlying insulin resistance with a more plant-based eating style. So what exactly is a plant-based diet? So the full term is a whole foods plant-based diet. Whole foods meaning single ingredient foods, unprocessed or minimally processed as they exist in nature. Plant-based, in its broadest sense, means we're consuming at least 95% of our calories from fruits, vegetables, whole grains, and beans. Typically, when we're working on reversing diabetes in the office, we recommend going 100% until we start to see the results we're looking for. For a lot of people, complete abstinence is easier than perfect moderation when it comes to a plant-based diet. So let's look at carbohydrates. They are not all good or bad. It depends on the type. So on one end, we have our unprocessed or minimally processed carbohydrates. These are our sweet potatoes, the logs on the fire. They are loaded with fiber and water and allow a nice slow release of energy. On the other end of the spectrum, we have our highly processed carbohydrates. This is our frosted flakes. These carbohydrates are digested quickly. They're void of fiber. A lot of times the water's removed. We've lost a lot of the nutrition and we get a big spike in energy. What does process really mean? It is any means by which a food is broken down or prepared. So typically we add salt, sugar, fat, making the food more addictive, more caloric, more delicious. At the same time, we are reducing fiber and water, making the food less filling, and thus easier to overeat. Plain old corn is an unprocessed food. It is a whole plant-based food. Highly processed, that's our Frosted Flakes, potato chips, those are the foods we want to avoid. Same idea with potatoes. So a potato is actually a great choice. It's going to be very, very low in fat to help you unclog those muscle cells, and the calories are fairly dilute due to its fiber and water content. But the reason potatoes are a problem is what people put on them, or what they make the potato into, like the potato chips. Same idea with wheat. Shredded wheat cereal, unfrosted of course, is going to be our least processed option. As we process, we get things like great grain cereal or crackers, cookies, etc. that are not going to be great options. Same idea with rice. Brown is best. With oatmeal, our best options are steel-cut oats or something like old-fashioned oats. These are going to be minimally processed. We want to avoid instant oats and refined oatmeal snacks. So what should I eat? Lentil tacos, mixed bean chili, grain bowls, loaded sweet potatoes, African peanut stew, black bean tortilla soup, vegetable fajitas, spinach and mushroom grits, vegetable tamales, rice and beans, collards, black-eyed peas, sweet potato black bean quesadillas, stuffed peppers. A lot of people overestimate how hard it will be to switch to a plant-based diet, but once you get going, it is quite easy to continue. If you want more information on reversing your diabetes with a plant-based diet, I'd recommend Neal Barnard's book, Program for Reversing Diabetes.
All of that is actually a shout out to Dr. Neal Barnard and Physician Committee Responsible Medicine in 2009, because 2 years before our government adopted it, they had published this fully plant-based food plate, which is the one that I eat off of and many of you eat off of, and we know properly prepared, as close to natural sources, avoiding hyper-processed food is a wonderful way to sustain health, and maybe a little B12 sprinkled on top for the heck of it. So at one point in Detroit, I was on a billboard pitching plant-based diets for heart disease and cancer and diabetes reversal. We've learned that indeed there's more data than ever.
Where they put them on a 100% whole food plant-based diet for just 25 days, 81% of the people reported significant improvement in their symptoms, including numbness, in just 4 to 16 days.
Type 2 diabetes can be prevented, arrested, and even reversed with a plant-based diet, something we've known since back in the 1930s. Within 5 years, about a quarter of the diabetics were able to get off insulin altogether, but plant-based diets are relatively low-calorie diets. I mean, maybe their diabetes just got better because they lost so much weight. To tease that out, what you need to do is a study where you switch people to a healthy diet, but force them to eat so much food that they don't lose any weight. Then we can see if plant-based diets have specific benefits beyond just all the easy weight loss. Well, we'd have to wait 44 years, but here it is. Subjects were weighed every day. If they started losing weight, they were made to eat more food. In fact, so much more food that some of the participants had problems eating it all. They were like, oh, not another salad. But they eventually adapted, so no significant weight change despite restricting meat, eggs, dairy, and junk. So with zero weight loss, did a plant-based diet still help? Overall, insulin requirements were cut about 60%, and half the diabetics were able to get off their insulin altogether, despite no change in weight. How many years did that take? No, 16 days. 16 days later. So we're talking diabetics who've had diabetes as long as 20 years, injecting 20 units of insulin a day, and then as few as 13 days later, they're off all their insulin altogether, thanks to less than 2 weeks on a plant-based diet, even with zero weight loss. Diabetes for 20 years and then off all insulin in less than 2 weeks. Diabetes for 20 years because no one had told her about a plant-based diet. Here's patient number 15, 32 units of insulin on the control diet, and then 18 days later on none. Lower blood sugars on 32 units less insulin. That's the power of plants. And that was without any weight loss. His body just started working that much better. And as a bonus, their cholesterol dropped like a rock to under 150 in 16 days. Just like moderate changes in diet usually only result in moderate reductions in cholesterol, how moderate do you want your diabetes? Right? Everything in moderation may be a truer statement than some people realize. Moderate changes in diet can leave diabetics with moderate blindness, moderate kidney failure, moderate amputation, maybe just a few toes or something. Moderation in all things is not necessarily a good thing. Remember that study that purported to show that diets high in meat, eggs, and dairy could be harmful to health as smoking, suggesting that people who eat lots of animal protein are 4 times as likely to die from cancer or diabetes. But if you look at the actual study, you'll see that's simply not true. Those eating a lot of animal protein didn't have just 4 times the risk of dying from diabetes, they had 73 times the risk of dying from diabetes. Now those that chose moderation, only eating a moderate of animal protein, they just had 23 times the risk of death from diabetes.